Hello, everyone. Thank you for joining us this morning for this very exciting opportunity to learn more about Planet Youth and the Icelandic prevention model. I'd like to start this morning with a land acknowledgement. We respectfully acknowledge that many of us here live and work within the Robinson-Huron Treaty, Treaty 9, and unceded Indigenous territory, specifically within the traditional territories of Beaver House, Matachewan, Temagami, and Timiskaming First Nations. Today, these lands encompass communities with the enduring presence of Algonquin, Anishinaabe, Ojibwe, Cree, and Métis peoples. We acknowledge that original peoples have been stewards and caretakers of these lands and waters since time immemorial, and acknowledge that they continue to maintain this responsibility for generations to come. With honor and respect, we say miigwech to the original peoples of this area and affirm our commitment and responsibility to reconciliation. My name is Bonnie Sackrider. I'm the Director of Community Services for the town of Kirkland Lake. I'm also a member of the prevention pillar of the Timiskaming Drug and Alcohol Strategy. I have been involved in direct programming with the municipality for over 30 years, and I see recreational opportunities as a key for prevention and probably even treatment. We are very fortunate to welcome our special guests, Jan Sigfússon, Chair of the Board of Directors at Planet Youth, who is joining us all the way from Iceland, and Robin Katrick, who is Planet Youth's Community Development Advisor, and Robin is joining us from Vermont. I must say, 2 locations on my bucket list. Thank you all for taking time out of your day to be here. We are so pleased to be able to share information about the Icelandic prevention model and believe there is potential for this approach to improve the lives of children, youth, and families in Timiskaming as it has in Iceland and in many communities around the world. As we'll learn later today, the Icelandic prevention model has resulted in astounding success and a dramatic reduction in youth substance rates. Due to its success, this approach is now being implemented around the world, including several communities in Canada and the US. This approach is being considered as a regional initiative involving Timiskaming, North Bay, Parry Sound, and Timmins area, and all these communities are hosting similar learning events this week. John and Robin, you're taking your show on the road. This all came about from work being done by the Timiskaming Drug and Alcohol Strategy in collaboration with the Timiskaming Health Unit. For those who are not familiar, the Timiskaming Drug and Alcohol Strategy was launched in January of this year and involves community partners from around the district. The goal of the strategy is to prevent and reduce the harms associated with substance use to improve the quality of life of all residents in Timiskaming. Our goal with today's event is to introduce you to the Planet Youth model for substance use prevention, to consider how our communities can use this framework to make positive changes in our district, and to start the conversation on the needs and the realities of the approach in our area. You are all in this room because you care about the well-being of young people and our community. In this room, we have representation from different sectors and agencies across the district: social workers, childcare, public health, municipal staff, elected officials, school board staff, recreation, culture, faith-based groups, people with lived and living experience, and we also have parents and youth. Preventing early substance use isn't the job of any one parent, any one school, or any one organization. We are all collectively part of the solution. It does take a community. We can all make changes, and when we work together in a coordinated approach, we will have greater impact and success than we ever would have alone. At this time, I'd like to introduce Erica Alterman, Public Health Promoter for the Timiskaming Health Unit.
Thank you, Bonnie, for those opening remarks and the land acknowledgement. My name's Erica, and I'm helping to facilitate today's event. I just wanted to start with going over the agenda quickly. You should all have a copy on your table. But to begin, we'll hear from THU's own Walter Humeniuk, and Walter will be providing a quick look at youth substance use regionally and provincially. After that, we'll hear from our first keynote speaker, Jan Sigfússon, and he'll present an introduction to Planet Youth. We'll then move into our second keynote speaker presentation by Robin Katrick, who will be sharing on engaging stakeholders and the importance of coalitions. After that, we'll have about a 15-minute break before we move into another presentation from Robin, where she'll share a look at some of the tools, resources, and supports that Planet Youth offers to their partnering communities. We also have a few videos sent in by Planet Youth partners from Frankfort, Kentucky, Lanark County, which is in Eastern Ontario, the City of Calgary, and the Province of New Brunswick. So they're all in various stages of implementing this approach, and we're willing to share some of their experiences with us. So we'll have at the end about a half hour for questions and then some closing remarks. The event is being recorded, and the recording will be available at a later date. Papers and pens are on the table in case you'd like to make any notes or make note of your questions for the end. And please, of course, make yourselves comfortable, get up to stretch. The washrooms are in the very back corner there. Help yourself to the snacks. We have lots of refreshments and snacks in the kitchen. And if all goes according to plan, the 15-minute break should be at around 10:30. So without further ado, I'd like to welcome Walter Humeniuk. Walter is a research planning and policy analyst at the Timiskaming Health Unit, and he specializes in the areas of substance use and health equity. Welcome, Walter.
Thanks, Erica. Good morning, everyone, and thank you for being here today. Also, a big thank you to my THU colleagues, Erica and Kim, for organizing today, and to Jan and Robin for making the trip all the way north here to present the Icelandic prevention model today. So as the title of my presentation implies, we're going to examine some youth substance use data. But before we do, we're going to briefly examine why substance use matters and why, as parents, educators, and policy makers, we should care. As we know, adolescence is a critical period of development, physically, emotionally, socially, and cognitively. It's a period of transition from childhood to adulthood, characterized by the adopting of adult behaviors and social roles. We now know that substance use can impact the development of the adolescent brain, which continues to develop until around 25 years of age. During adolescence, the prefrontal cortex, responsible for personality, inhibitory functions, as well as decision making, and the amygdala, which is responsible for processing emotions, continue to undergo substantial development. The hippocampus is involved in the memory formation. All three are negatively impacted by alcohol use and possibly other substances as well. We also know that adolescence is a time of impulsivity and thrill-seeking behaviors, all of which put our youth at risk of unintentional injury. A recent study published by the Canadian Centre on Substance Use and Addiction illustrated the unintentional injuries associated with youth substance use. In this study, emergency department visits involving youth substance use were explored in 3 locations across Canada. Of the 3 substances under study, alcohol accounted for 69.3% of the ED visits by youth aged 12 to 24 years, followed by cannabis and then opioids. Almost half the ED visits, that's 45.1% to be precise, were related to unintentional injuries. Out of the 3,600 emergency department visits, almost 4% required resuscitation, and 49% were deemed life-threatening. While we don't normally think of chronic diseases during adolescence, we know that long-term use of substances can pose health risks. For example, alcohol is a direct cause of over 60 chronic diseases, including 7 different types of cancer. We still don't know the long-term effects of vaping, but we do know that chronic marijuana smoking increases the risk for COPD. Adolescence is one of the most influential periods of an individual's life. Both healthy and unhealthy behaviors established during adolescence can continue to influence health well into adulthood. The risks associated with youth substance use can be acute, including intentional or unintentional injuries, physical violence, accidents, or poisonings, or they can be chronic, leading to poor academic performance, addiction, relationship problems, disease, and so forth. About 90% of individuals diagnosed with substance dependence started using substances before the age of 18 years. The earlier the age of onset of use, the higher the risk for substance use issues later in life. In Canada, the average age for alcohol onset is 13.4 years. So why have I focused on alcohol and cannabis so much? Well, the data tends to show that the most commonly used drugs among students in grades 7 to 10 tend to be the legalized ones, such as alcohol and cannabis, with alcohol being the most common. In Ontario, alcohol is responsible for 67% of admissions to substance use treatment programs. When we look at the cost to the Canadian economy, alcohol leads the way with a cost of $16.63 billion per year, followed by tobacco at $12.28 billion. This is followed by opioids, cocaine, and then cannabis. These costs include costs to our healthcare system, our justice and legal system, as well as lost productivity. It's interesting to note that alcohol costs the Canadian economy more than all the illicit substances combined. One of the biggest challenges as a smaller district pertains to our ability to obtain current local substance use data. Often we resort to using regional data or provincial data for our purposes. The pandemic posed another hurdle as virtual learning became the norm and data collection became more difficult. Sample sizes were so small for the 2022 Ontario Student Drug Use and Health Survey that the authors presented the data for Ontario as a whole without breaking it down by region. Local data collection is an area I believe that the folks at Planet Youth will be able to help us out with. For today, the data that I will present will be based on the 2019 data published in the 2020 Ontario Student Drug Use and Health Survey. So based on that data, we can see that the most commonly used psychoactive substances used by youth in grades 7 to 12 is alcohol, with approximately 42% of Ontario students having used alcohol in the past year, compared to 47% in Northern Ontario. This is followed by vaping, cannabis use, and finally tobacco. We need to be cautious in saying Northern Ontario rates are higher than the rest of Ontario, as no analysis were calculated to determine the statistical significance. However, as you can see here in the next slide, there is a pattern that remains relatively constant. So here we can see that compared to the legal substances, use of illicit substances is less frequent among Ontario students. Somewhat surprising, probably due to the amount of media attention and the rise in the accidental poisonings, is the percentage of students who've used opioids for non-medicinal purposes in the past year. Mushrooms, mescaline, and cocaine use seem to be equally common in Northern Ontario, followed by ecstasy and LSD. When we look at other illicit substances, their use is quite infrequent, with less than 1% of students using them. In fact, the use was so infrequent that the sample size didn't allow for a reliable analysis. While we might be tempted to breathe a sigh of relief that our youth are using legal substances instead of illicit substances, we need to bear in mind that the use of legal substances still pose a substantial risk to youth. And we should really ponder why they are using psychoactive substances at all. A number of factors influence behavior, and it's difficult to understand behavior outside the context in which it occurs. Substance use by adolescents should not only be viewed in terms of an individual health behavior, but as a social practice that is influenced and reinforced by the context in which it occurs. In order to adequately address substance use, interventions and actions are required at various levels as outlined by the ecological framework. The success of the model implemented in Iceland, I believe, was attributed to the fact that it addresses these various levels. I'm going to turn things back over to Erica now, and I look forward to learning more about the Icelandic model from Jan and Robin. Due to time constraints, if you have any questions or comments regarding the material that I presented today, please feel free to drop me an email, and I'll be happy to respond in a timely manner. Okay, thank you.
Thank you, Walter, for that presentation. Please don't hesitate to contact him with your questions because he really loves to talk about this stuff. So at this time, I'll introduce our first keynote speaker, Jan Sigfússon. Jan is the chair of Planet Youth, serving as the head of the Planet Youth Guidance Program internationally. He served as the director of the Icelandic Center for Social Research and Analysis for 20 years and has been involved as a board member in various international entities such as European Cities Against Drugs, Europe Against Drugs, and more. Jan has served as a coordinator on various projects also aimed at enhancing social factors and well-being of youth and promoting effective interventions based on proven methods such as Youth in Europe. Jan has lectured on evidence-based primary prevention at conferences worldwide and has been published in peer-reviewed journals. He's received so much recognition for his work related to youth substance use prevention, and it's truly an understatement to say that he knows what he's talking about. And finally, Jan is a family man, a proud father, and a grandfather to many. Welcome, Jan.
Thank you, everyone, for having us here. We are really honored and pleased. I was referring to a yearly poll about the most likable people in the world, and I was talking to your Governor General last year, and telling her that Canadians, they always come up on the top of that list as the most likable people in the world. So that's why Robin and we chose to be here, but not in some other country. So guys, thank you. The switch is here, or okay. I'd like to start by showing you a picture taken downtown Reykjavik, which is the capital of Iceland. I think this was the summer of 97 or 98. It's the middle of the night. You know how it is up in the north. It's daylight all day. And this was a typical scene. The city was full, the downtown was full of young people, and far too many of them using substances. I, at the time, as an adult, I didn't dare to go down there even. And at this time, Icelandic adolescents scored among the highest in substance use in Europe, according to the SBAT study. So the situation was pretty bad. And what we had been doing was this until around the millennium, and we had been trying to teach children and adolescents how they should behave and take responsibility of their own lives. Just say no to drugs, even though all your friends are having drugs. You just say no, my son. This was not working, and this is not working. So it was decided that we needed to do something totally different, and we did. 5-6 years ago, an article was published about the work in Iceland, and when I say we, in Iceland, it's all the people working on prevention. It's everybody. It's not only the researchers, it's the practitioners, policymakers, parents, everyone. And this was published, and the methodology of what was being done in Iceland. But this was the title. Iceland knows how to stop substance use, but the rest of the world isn't listening. And I was in the middle of nowhere in the winter of 2017. All of a sudden, the mailbox started filling up, and the phone started ringing because this article went viral around the world. And so we just needed to decide, are we going to try to walk fast, run fast, and try to help those who want, or shall we say we're fully booked? But we just decided to step up our game, and now we have the systems up and running. But what is it, sorry, that people are referring to? This graph shows the trend from 1998 it's somewhere there, to 2022. And in 1998, 42% of our 15 and 16-year-old, the last year of obligatory school, had become drunk for the past 30 days. 23% were smoking cigarettes daily, and 17% had a lifetime experience of cannabis. So by working the way all the people were working, we managed in about 15 years to become among the lowest in substance use in Europe, counting all the countries. And since 2013-14, it's been our job to simply try to keep these numbers low. There are always, of course, new challenges, but the industry is working 24/7, but we managed to keep it low. And for the past few years, this methodology has reached 16 countries in 5 continents, and I don't remember how many municipalities, 500 something. So, and that's what basically we're doing. And I know there is always a question that will come afterwards, so I just answer it now. How do people fund this? How much does it cost? And this is very, very different. The cost per year for a local unit, our fee is 31,000 euros for everything that we do. And Robin will tell you more about what it is that we actually do. And no hidden fees or anything like that. And then people ask, but how is it funded? Still trying to make this work here. Yeah, it's in so many various ways. It's federal agencies, local governments, state governments, NGOs. Even in New Zealand, it's the New Zealand Football Association. So it's funded in different ways, but it has to be a long-term funding. Nothing happens in 1 year. So we require our collaborators to sign up for 5 years. And then you should be seeing outcome changes and at least process changes. So how was this changed? We have been working with these 3 pillars. Always use evidence in whatever we do and decide. We have to forget our feelings. We have to have everything that we do in this work based on evidence. Like if you were building an airplane, you have to know what you're doing, you know. You cannot think that it should be like this or that. It has to be community-based. Robin will talk more about that. We have to work always in your area because you would have nothing to do with changing the situation up in Whitehorse or anywhere else, you know. You can work here, not in the whole country, but here. And finally, we have to keep the dialogue open between researchers, policymakers, and practitioners. You know, without a dialogue between everybody, nothing happens. If the researchers know what they know and they don't tell anyone, you know, and the practitioners get no information and the politicians decide not to do anything, nothing happens. So, and through the years we have often been asked, why are you putting all this emphasis on research? And it's simple. I mean, everywhere you want to succeed, you need to know what you're doing. You need to have empirical research facts about how the situation is and what happens if you do this and what happens if you do that. So why should we not use research when it comes to the most important in our lives, our kids? Why should we then start using our feelings or what we think? We have to continue using research. And we have to cure the society, the way we think, the way we act in and around children. Of course, we need to help all the individuals who are in need for help. We need to do that. But at the same time, we also need to start looking at how can we prevent an individual for becoming, for example, a drug addict. Like you mentioned, I mean, if you start early, you are so many times more likely to become dependent on drugs. We had a lot of data since '92, data that we collect in schools. I'd like to mention here that schools are not responsible for the children's upbringing, but it's very important to have a good collaboration with schools in order to get good information. And the questionnaires that we use, they're not asking only how much you drink or smoke or things like that, but we ask about everything in the environment of children. You know, we ask about their connection with family, friends, their leisure activities, everything that really matters in the life of a child. And this we need in order to be able to find the local risk and protective factors, what needs to be addressed in this local area. I'll come to that later. And every time we collect data, and when I say we, it could be you, we deliberately divide it into these 2 parts, scientific and practical. We published 150, 60 international papers on this, from this data. And that can take us 1, 2, 3, 4, 5 years to do. The last was in the Lancet last year. It took, I think, 3 years in the making. And I mean, if just to mention it, if we collect data here in your community, or you collect it, it's your data. We only need it in order to be able to provide you with the local findings. So the practical part of this data collection or research is that immediately 6 weeks after, maximum 8 weeks after a data collection, you get your information here. You get 3 kinds of reports. Municipal report, school report for every school with blind comparison with other schools, and you get a flyer or an infographic document that you can show to parents. And the reports that we create, they are no mumbo-jumbo text and Excel tablets. They're all visual, so everybody can understand what they're saying, the situation, and also the risk and protective factors. So we have to make sure that when you collect data, you get the information so you can start working immediately. So it's your kids now. It's not somebody else's kids maybe last year or 2 or 3 years ago, or the children in the whole state of Ontario or Canada. That kind of information is useless in primary prevention. You have to have your information. And just an example, everything is very visual. Now, what would we learn if you come with me back to 98, okay? We could see, the people working in the field, from the data, that there were certain factors connected with if children started to use drugs or not. So that was what we called the risk and protective factors. And we tried to understand and find out if we address these factors. These were just correlations. We were not looking for causalities, but we saw correlations, and we thought, if we address this factor, will it change? Will it reverse the situation? And this is always a cross-sectional research, always the same age group. So we find out if we do that, does it work? Will the children in next year or after 5 years in the same age behave differently? And these are the factors that were the main issues to deal with: the family factors, the peer factors, the school, and the organized activities. And it was possible to see from the data that the children who said they spent more time with their parents than less, they were less likely to start using drugs. If children reported getting support, caring and warmth at home, less likely to start using drugs. If they reported that their parents knew where they were, the kids, in the evenings and with whom, less likely. So we could start teaching the parents how they could be the biggest preventive factor in the lives of the kids. So we didn't go to the children with this, but to the parents. The peer group, we could see different effects. We could see, for example, it was a risk factor if your child was hanging out late at night with your friends, doing nothing. That was a risk factor. These kids were more likely to start using drugs. And we are always talking about delay the onset of, for example, using alcohol. We are not, people say, never drink or something like that. Of course you should not, but the focus is delay the onset, as Walter, you said in your opening speech, which is so important. You said 13.5 years in Canada, alcohol. We have to get that bar up. We could see the schools, and this goes without saying. Children who report that they feel well in school, they're less likely to start using drugs. If you're being bullied or don't want to go to school, or you're more likely to do something else. And we could see the leisure activities. They were also important, and we've learned a lot there. We could see that children who were participating in organized activities 3, 4, 5 times per week, they were less likely to start using drugs. However, we thought this was like some magic. And later, in 2006-07, we started working in some other countries in Europe. We could see that leisure activities, they could also be a risk factor. So just imagine here we have a basketball practice, and we could see that the quality of the activity also needed to be really high. we need to make sure that just as when we send our child off tomorrow to school and the first class is mathematics, you assume that that teacher knows how to teach mathematics, right? You have to demand the same when you send your child to the basketball practice. You have to be sure that that trainer, those trainers, are really good role models, and they are not drinking and smoking, inside the building or outside. So the organized activities, the activities have to be really well organized and of a high quality. And this is what we've been trying to get better in every year. So get more trained trainers. Of course, volunteers are hugely important, but you have to be sure that the quality of everything is good. So this is 98. It was decided to do something totally new because what we had been doing was not working. And you already mentioned this morning upstream, and we find this so normal today. Instead of saving kids who have fallen in here, we try to build fences up here so they don't fall in. We think it's so, what we should do. So just my last 3 slides, working with Planet Youth. We have today really organized structures. They're of course very adaptable. We cannot say that whatever works in Iceland works in Canada. So there are always local conditions that we have to take into consideration. However, there are certain guiding principles that always apply. Apply a primary prevention approach, empower the community activities, engage and empower the community members in the work, integrate research policy and practice, and the last one, my favorite, match the scope of the solution to the scope of the problem. Much too often we see even governments take loads of money, throw it into one direction because, check, we have put money there, without knowing if it's really what needs to be done. This is what Robin and the team are so good in. So the communities who engage go through steps, and they're all like really structured, and of course I see some of you are taking pictures. You can just have these slides, right? Erica, you can distribute them? Okay, so there are no secrets in here. And as I said before, we require a 5-year commitment because there is no magic bullet. There is no, no magic at all. This is just structured, organized collaboration. So that's what it is. And I know Robin is going to do this, the community focus. So are you going to save me now, Robin? Thank you.
Thank you for that presentation. We'll move right into our next one. So Robin Katrick is a public health and community development professional with extensive experience in primary prevention, program development, and community mental health. She lives in Vermont, United States, and is the Community Development Advisor at Planet Youth. Before joining the Planet Youth team, she facilitated the implementation of the Planet Youth methodology in Vermont and supported communities in creating healthy built environments through strategic planning efforts, cross-sector collaboration, and statewide partnership building. In previous roles, Robin has also previously worked in community health promotion, direct service in mental health, and international community development. Robin holds a Master in Public Health and a Bachelor of Arts in Community Development. Welcome, Robin.
Hi, everyone. So I'm going to talk a little bit about how you actually start implementing this in communities, what you could do tomorrow, even before signing on to Planet Youth. Part of my job, which I love so much, is coalition building. That's something I could talk hours about, and I promise I won't today. But if you do sign on, I offer a really great coalition building training where we work through a lot of this stuff. So as you saw from Jan's slides, we have a 10-step process. And step one in the process is creating a local coalition. This is truly the foundation for your entire work. So you really need a strong local team. You need a great number of stakeholders coming together to work for the same goals. So this is step number one. It's so important. It's going to help you throughout the entire Planet Youth process. The coalition also makes it easier to implement the 10 steps. So as you saw there was 10 steps. You collect data, you disseminate the data, you create goals and strategies, you work on policies. All of this is possible with a small group of people, but it's way better if you have a lot of stakeholders willing to take on these tasks. And the local coalition, of course, has the knowledge about what's happening in the community. So the more people you have involved, the more you're going to be able to create those goals and strategies that are going to have a meaningful impact. So step number one, identify and develop a strong community coalition, and it's going to focus on primary prevention. That's what we're all about. We're on the upstream prevention. This whole methodology will support you through that. And this phase really allows you to build a strong foundation. It also should not be rushed. So often our communities will take their time building a coalition even before signing on to Planet Youth so that they can have a strong local team before they start collecting data and all of those other steps. One thing we do encourage is that you bring all necessary members to the table. So this coalition is not meant to be an exclusive group. You want all the voices you can have at the table. You really want to make sure that you're listening to the community, getting that feedback, getting that expertise. So we ask that it's not an exclusive team that's just carrying out tasks brought down by a coordinating level. You really want this to be a community-based approach. And I sort of already talked about that, so just making sure that you're not leaving people out. So this is an example of what community stakeholders you may include on a coalition. Granted, if you're a small community, you may not have all these stakeholders in your community, and that's okay. Every community does look different. This is just an example to give you an idea. Often our coalitions include elected officials and policymakers, civic and volunteer groups. Community serving organizations, of course, are some of our main stakeholders in all our coalitions across the world. Mental health professionals, public health professionals, healthcare. Social scientists and researchers are also a really great stakeholder. However, not every community has this. If you don't have a major university in your town, you may not have this group on your local coalition. And we say that you can always bring in that expertise when needed, but really the decision making should lie with those local stakeholders. Faith community, law enforcement, parents and caregivers are so important. You really want those on your coalition, as well as schools. One note I'll say about schools, and I'll also say this later, this is a community-based approach. So you do want schools on your coalition. They should have a strong role, but this is not the responsibility of the schools. You will be surveying the youth in the schools, but you're not going to have the schools do all these goals and strategies. So this is a community-based approach. And the reason this is a community-based approach is the community knows their resources and what the community needs the best. We can't tell you that at Planet Youth. We can give you the data. We can give you an idea of what's going on through the survey, but you really know the avenues to reach goals and strategies and intended outcomes, and you know what's happening on the ground. So we really want you to take ownership of this process and really have a strong local coalition. And while the local coalition is really important, one thing I will say is the local coalition should not make decisions for the entire community. The community needs to also have a say. Not everyone in the community is going to be on the coalition, so you need to gather feedback. And you can do this through dissemination meetings. We help you through this. It's part of the Planet Youth process. It's, I think, step 6 is our dissemination planning. So we'll really work with you on creating those plans and how to gather feedback from your community members. And another important thing is to develop influence. Something I talk a lot about in coalition building is how to gather those community champions. Sometimes you have champions in your community that aren't a specific stakeholder group. You still want those people at the table. You need to know who they are. Who are those people in the community that can really garner action from the rest of your community members and make things happen? These are the people that are really going to develop influence and help get this project going in your community. And finally, community work is long-term work, and it requires a lot of patience. So this is not a quick process. Primary prevention is one of those things where you have to be really patient, but it's really rewarding. So something we say a lot, and I hope this helps you if you decide to sign on, is that working through the process is progress. So each of those 10 steps that you work through, that's progress, that's an outcome. You've built a coalition that's coming together and communicating well. You've disseminated data. Those are all things that you can say that was a really great outcome. That was something that really helped. So process is progress. I want to talk a little bit about the benefits of local coalitions. I could talk a lot about the benefits of coalitions. That could be a whole presentation, but I'll just stick with the top few. Coalitions help avoid duplicating efforts. If you have all the stakeholders in the same room working toward similar goals and outcomes, you're not working individually, which happens a lot, I know, in the United States, where I'm from. You're really bringing these people together, the expertise together, and it's a combined effort to reach these outcomes. It also empowers the community and local stakeholders to take action together. It can feel really isolating when you're working on this work alone or within your organization. So when you have a multi-sector coalition, it can feel empowering. It can prevent burnout when you've been doing this work so long alone. I know that can happen. So really, the coalition should be an empowering place to be. And it builds excitement. So there's something about coming together with people that are wanting to be a part of the same process and reach those same goals and create healthier environments for youth. It can be really exciting. It can help you make an effort in the community that may have been stalled before. And it increases communication. It's really easy when you're working within your organizations to forget to talk to stakeholders that you don't typically work with, but in this coalition, business owners are talking to the schools, and mental health professionals are talking to law enforcement. And this is like a really great open communication environment. And of course, combining resources to have a greater impact. And what I mean by resources is not just funding. Sometimes that can be confused with funding, but resources, I mean skill sets, expertise, funding, of course, but time is also another really great resource. When you have a great group together, you are going to be able to have many more resources to reach intended outcomes. And of course, the coalition helps create long-term and permanent change. This is not a process where you just work on this for a year or two and then the coalition disappears. This is meant to be a long-term team that is going to keep coming together, keep reviewing the data, and make sure you're having goals and strategies that are going to have a big impact on the community. So it's a long-term process and permanent change in the community. I want to talk a little bit about project structures. Again, your community may be different. This is an adaptable process. What works for one community isn't going to work for another community. But I do want to give you an example of what the structures look like among our sites around the world. You have us at the Planet Youth team, of course, and after our break, I'll talk a little bit about what supports we offer, and we're always in touch with not only the Planet Youth partner, but the local coalitions as well. There's a lot of touch points with trainings and advice and all of that good stuff. Usually, we're most in contact with the Planet Youth partner. Whoever signs on, we just need a contact person where we can make sure things are running smoothly. Once in a while, we have a regional coordinator. I don't think that will be the case here. It seems like it's a small community, so you might not need that. But for example, our project in Chile, which has 300 communities, you need some regional coordinators to help make sure everything is running smoothly. So that's just an option. And of course, your project structure may look different, and that's okay, and we'll help you figure that out. And just quickly, I want to talk about the coalition role. So the coalition serves to inform, motivate, and initiate the community work. You're there to really help the community move forward and work on creating healthy environments for young people. The coalition works collectively as a team and builds the capacity to achieve goals focused on reducing substance use and creating healthy environments for children and adolescents. You're the ones that are going to be working through the 10-step process and really helping the community understand what's happening with the young people. And this can look like building community awareness, talking about Planet Youth when you're first getting started. That's one of the first steps of the coalition. You'll disseminate data findings, most likely through community meetings, but also materials you may create community goals and strategies, and also just implement the work, whether that's figuring out policies and laws or looking at what's working well in the community through community asset mapping. There's a lot of different avenues for the coalition. So I want to talk a little bit about next steps and what you could do even before signing on for Planet Youth. And you just want to be clear with the community and the coalition about how your goals probably already align with this process. It sounds like, from what I've heard today, that your community really wants to build healthy environments for young people. So it's all about how this process may work in your community and being very clear about what this is and what it is not. And you can be specific about the strengths and resources your stakeholders have and how that could work for a coalition. You can demonstrate how Planet Youth can help stakeholders with individual goals come together and reach long-term goals. I usually find that when you bring a group of stakeholders together that are focused on creating healthy environments for young people, the goals often align more often than not. So just coming together and talking about that and figuring out where the alignment falls. Another important thing is to get to know your stakeholders. This is my favorite part of coalition building because you never know the strengths that you're going to find with your stakeholders. I love hearing the different skill sets and hobbies of different stakeholders. We often have like school principals who say, hey, I love graphic design. I want to create materials around data dissemination. Or you have a business owner that really loves working with youth and wants to help create a leisure card. So you never know who has what interest and specialties, and it's really fun to get to know all your stakeholders and why they want to participate in this work. And just create a team that knows each other. It's so important. If you're going to work together, and this is tough work sometimes, you really want to get to know each other, and it's really important to be around each other. And build trust. Build trust not only in the community, but with the coalition. Make sure that promises are followed through on. Make sure you're not promising a process or a project that isn't, that's going to provide quick wins. Primary prevention, of course, is a slow process, and working through the process, again, is progress. So just make sure you're following through on promises and make sure that your stakeholders know what the commitment is for this work. And as I mentioned, I was going to come back to this. Make sure your schools are on board. This is really important because the schools are a hub for young people. This is where they spend a lot of their time. This is where a lot of community members also gather. You have parents there. You have community stakeholders that are often connected to the schools. You want to make sure they're on board. They have to administer the survey. You want them on your coalition. But again, this is a community-based approach. This doesn't fall to the schools. This is not the responsibility of the schools. I can speak from experience in the United States. Our schools often feel like when there's something going on with youth that they're held responsible, and it shouldn't be the case. It's a community thing. You have a lot of stakeholders that want to work toward youth health and well-being, and you just need to make that known. And finally, just remember to advocate for the community. Coalition is there to really hear what the community has to say. You know the community well, and make sure that when you're moving forward with whether it's data dissemination or goals and strategies, that you have their voices in mind and in your thoughts while you're creating those goals and strategies. And I think that's where we're going to take a little break.